Hello, everyone. Hello, beautiful people. I'm sorry, so sorry for being a few minutes late. My internet was giving me some troubles, but we are here now. And how are you all doing? How is your day going? Hope you're having a good day, and hope like leave something in the comments section. Like, leave something so that we can acknowledge your presence before I start. I'll be starting really shortly, and it's a topic which I've tried to summarize to the least and make it as understandable as possible so that we can all understand it. It's a very, very complicated topic, but if I, who is not a doctor, who is not a nurse, and didn't even do any form of sciences in high school, can talk about it. Anyways, I did maths. That's a little bit of sense. Can talk about it, then you can understand it. Thank you so much, Lady Rudy. I can see a hello. Thank you so much for joining. Um, Time waits for no one. I won't want to delay anybody. I see another person. Please, if you're around, leave a comment, leave a like so that I can acknowledge your presence before I get into the topic of the day. Who is there? Wow, Scholar Tinty. Thank you so much for joining. Wow. Thank you so much for joining. I'll get right into the topic of the day. Thank you so much, Scholar, for joining. You're welcome. It's so nice seeing you there. It's been so long. She's actually my classmate and a friend. Okay, so I'm just going to get into the topic of the day. One reason which keeps me motivated to keep doing what I'm doing is this is social media. Someday, some woman is going to get on this video and she's going to learn something. And it's that day I'm doing this for. And I'm doing this also for you ladies who are here right now, who are willing to learn. It's not easy to make out time to learn, but it is very, very important. That is one thing I would like us as women, as mothers to know. It is very, very important that we keep ourselves in the know and we just be informed, because normally if you are counting on the hospital system in our country, especially if you're in Africa or Cameroon in particular, I'll talk about my country. If you are counting on our hospital system, my dear, you better start studying, because you have to know certain things. While I was in the hospital with my daughter, a nurse almost made me to give her something which was meant to be a rub. She was telling me something that I had to instead rub in her mouth. And I told her quickly, this is not the one to rub in the mouth. I'm still to get that one. This is the one which is supposed to be rubbed on her body. And then that's when she looked at the name and she was like, hey, it's true. So if you don't educate yourself, I don't know. But what we usually tell ourselves to have peace of mind is that God knows why. But there are certain things which us as mothers have to take it into our hands. We cannot leave our lives or the lives of our children in the hands of just these medical practitioners. We have to try as much as possible to study the little that we can, because there's information everywhere these days. We just have to get aware. So once again, thank you all so much. I can see Lady Maureen. I was just winding time so that I can acknowledge everyone who is here. I can see Lady Omo Cash. Thank you so much for being here. You all are welcome. Today we are talking about gastroschisis. Yeah, as complicated as the name sounds, that's how complicated the birth defect is. This month we are talking about birth defects on Inyango. We are going to be talking about 4 common birth defects. There are a lot of other birth defects which I'll try to talk about in future times, maybe with short posts or short videos, so that we can be aware about these things, because us as mothers, we have to know these things. There are children who are giving birth to with this birth defects and they are thrown away. They think that the children are witches or wizards, but we have a responsibility to the babies that we'll give birth to right before we even give birth to them. Even before we conceive them, it is our responsibility to ensure that we have enough knowledge to bring forth healthy children to the world. And we are eating healthy enough. we are living a healthy lifestyle so as to ensure us to have healthy babies, because it is very important. It's not just about having the name of a mother. It's not about a title. Motherhood is service. Is your own service as a woman to the world. So let's get right into the topic of today. I can see Lady Christelle. Thank you so much, Vanessa, for joining. Thank you so much, Lady Vera, for joining. It's a very important topic, and I'm so happy that you all are here. You're all welcome. I'm so happy to see you ladies here. Please stay on, and please don't forget to share the video so that a mother somewhere can get this information as well. Please try and share, leave a like, leave a comment, leave anything. Just leave your opinions. I'm speaking. Anything that comes to your mind that you can say, please say it. Feel free. We are here together. This is not about me. It's about mothers in general. And this is about us sharing our ideas. So I'll go right into the topic right now with no further ado. So we are talking about gastroschisis today, gastroschisis. That's actually how it's pronounced, but it's not pronounced the way it's spelled anyways. So this particular term, gastroschisis, is coming from a Greek word which means belly cleft. You remember when I talked about cleft lip and palate, right? A cleft is like a crack or an opening where it is not supposed to be, like a crack. Yeah. So gastroschisis is from a Greek word which means belly cleft. So gastroschisis is actually a birth defect which occurs on the abdominal area of the baby. That is, it occurs on the baby's belly. It is a birth defect which leaves a hole on the baby's tummy. I will try to use common language as possible so that we all understand. The aim is for us to understand, not for us to hear the terms and then we don't know what we're talking about. So gastroschisis is just a hole, a defect which leaves a hole in the baby's belly. And it is mostly found on the right side of the umbilical cord of the navel. Of the navel. Let's talk normal talk here. It's usually found on the right side of the navel. So it is not, the defect is not on the navel, it is on the right side of the navel. And it's a defect whereby the belly tissues don't form properly when the baby is developing. So it leaves a hole there, thus making the baby's intestines to come out through that hole. So they develop outside instead of inside. This is not something that we'll see very commonly, because most times when this baby so they don't bring them out to the ward like when a normal woman gives birth. They leave them inside. They take them to intensive care for them to be taken care of, or take them for surgery immediately. So as I said before, it is a birth defect on the abdominal wall, that is on the belly of the baby, which leaves a hole, usually on the left, which leaves a hole or a cleft, usually on the right side of the baby's navel. So that's typically what it is, making the intestines to develop from outside. Thank you so much, Mata, for joining. Thank you so much. You're welcome. And we have to also understand one thing here. During the first weeks of the baby's formation, of the embryo's formation in the tummy, like, it's just wonderful. Most times when I sit and I watch videos on the animated form of how the baby grows in our tummies, I just can't stop watching. I'll watch from one to the other. Before I know, I've spent hours just learning how the baby forms in the womb. It just gets me so excited. Don't think I missed my calling. I'm where I am supposed to be. I'm supposed to be here just teaching you ladies, learning like that. I'm not supposed to be working in the hospital. I don't think that's my calling. So we need to understand that when the baby is forming, around the 3rd week or 3.5 weeks into the baby forming, the digestive tract starts to form. And around the 6th week, the intestines and all the things in the digestive tract start elongating. They start getting long. And by the 3rd week, the digestive tract and all that, the abdominal wall or the abdominal cavity, as they'll call it, starts forming. I don't know, my internet is doing something, my God. The abdominal wall starts forming. And this is where the problem can come from. When all the organs, when all those major organs have formed, and then the abdominal wall has to cover them up, it forms in some kind of I don't know how to explain it. It forms some kind of ball, and then the abdominal cavities now have to close up on it. So if they don't close up tightly and leaves a hole, you see that the intestines will protrude outside. They will actually form outside of the baby instead of remaining inside. Now, there is another birth defect, abdominal birth defect, which is mostly confused with gastroschisis. And this is, what's that name again? Omphalocele, that's the name. The name of this other abdominal defect, which people mostly confuse it for gastroschisis, is omphalocele. Omphalocele is a case where the baby's intestines and other organs, the liver, the spine, like a lot of other organs, don't form inside for the baby instead. And this makes this particular one in omphalocele, it forms in some kind of sac. So it actually forms outside, but the intestines and the organs which were left outside are not exposed, like in the case of gastroschisis. So in the case of gastroschisis, most times it's just the intestines which are out, except in very severe cases where you might find things like the liver, the spine, and other things. But the main defect, which is even more serious, is omphalocele. Here too, the intestines are out, but the intestines are out with some other organs, and it does not remain outside empty. It's in some kind of sac. I would right now put a picture so that you can see the two. When I put a picture, you won't be able to hear me. So it's okay. Just look at them. I think the diagram on, if I describe now the hand, which is, it is on my screen, it might be different on your screen. But just look at the difference. One, the intestines are out and they are in the open air. They are in contact with the amoebic fluid. That fluid, which is what surrounds the baby inside the mother's womb. But the other one, which is omphalocele, is outside as well, and the organs kind of put a picture so you can see that before we go on to explain this more. Okay, I've just put the picture. Let me remove myself from. I am sure that you ladies have seen the difference in the two cases. In the first one, you see that the baby's intestines are outside on a hole which is beside the navel, which is the umbilical cord. And in the second one, that one is gastroschisis, what we're talking about today. And in the next one, which is mostly mistaken for this one, which you're talking about today, omphalocele, the organs are actually protruding out of the navel. You see that they are in a sac, and then the umbilical cord is continuing after it. So that's the difference. So that is omphalocele, which is a more serious birth defect and usually comes with a lot of problems. And then there is gastroschisis, which is what is more common. For gastroschisis, it happens 1 in every 2,000 babies. And if you consider the fact that babies are giving birth every second, you would know that it's actually something which is serious. But in the case of omphalocele, it happens 1 out of every 4,000 babies. So gastroschisis is a more common birth defect. Okay, now let's go on. I had given you the definition of gastroschisis, and next I'm going to talk about what the causes and some facts which you need to know about gastroschisis. Now, we need to understand that in gastroschisis, since the intestines are outside of the baby and it is in the amoebic fluid, that is that fluid which surrounds the baby, which is what comes out when the water breaks and the baby, it's time for the baby to come out. I hope you get me. Please, if you get me, leave something, leave a comment so I know I'm communicating and you're understanding me. So since the intestines are outside like that and they get into contact with that particular fluid, it might lead to swelling, shortening, like twisting. It might just irritate those intestines, which makes it an emergency. It is something which cannot be solved immediately. It is diagnosed if it is diagnosed before the mother gives birth, but it is usually rectified immediately the baby is born. Okay, now let me give you this one fact. Most times in Africa, we don't really have census done on these things. We don't have some really good research done on these things. But if you can imagine that only in America, 1,871 babies are born each year with this particular defect, gastroschisis. So you understand how much it is. If 1,871, approximately 1,871 babies are born with this defect in America, I know some of us might start thinking that we are blacks, we are immune to these things, but not really. Not really. So with that, let's go to the causes. Now, the main causes of gastroschisis have not been found as research has still been done, but there are some clues on the other researches which have been done, which kind of puts a particular segment of women to be high risk of giving birth to a baby with gastroschisis. And the ladies who are in high risk of giving birth to children with gastroschisis are mostly ladies who give birth at an early age, that is teenage mothers, ages below 20, giving birth below 20 might put you at higher risk of giving birth to a child with gastroschisis. And also the consumption of alcohol, tobacco, and nutrition, some toxins from the environment, and generally nutrition might be factors that can lead to gastroschisis. Also, the environmental effects which might lead to gastroschisis are mostly have been noticed to be in things like pesticides. Those are things, components which they have seen that in most mothers who gave birth to children with gastroschisis, they were mostly exposed to these things. So those are some environmental effects that can lead to a mother giving birth to a baby with this particular defect. We just have to try to eat healthy. I'll preach healthy eating today, tomorrow, and forever, because I know the value of it. Most times, it must not make you to get slim, look beautiful, look all shaped up, because that is the main reason why most of us start working out, start eating healthy. You have to just try to live a healthy lifestyle for the good of yourself and for the good of your children, because all these things contribute. You smoking, you taking alcohol, you taking drugs, is not good for anyone. It's not good for you. It's not good for your future babies or your babies now. It's not good for the world at large. So please, if you are doing these things, try as much as possible to try to cut them down. One step at a time, you'll get there. We don't judge you for doing these things, because I believe that you're probably taking drugs or taking alcohol or taking tobacco for one reason or the other, for one stress factor or the other. But I believe in you that if you stand by yourself, that you don't need these things to take stress off your mind, you can actually condition your mind in a way that you can deal with the stress in another way, instead of taking things which are going to harm you, harm your generation, harm everyone around you. Okay? So you can do it. If you're smoking, try as much as possible to reduce it. Smoking in both men and women, alcohol in both men and women. So for the betterment of your future children, for the betterment of your generation and for the future generation, we just need to cut these things off. So now, I've talked about the risk factors, since there are no main causes which have scientifically been proven, but those are people who are at risk, teenage mothers and people who consume alcohol, tobacco, drugs, overall unhealthy lifestyle, nutrition, environmental factors, and toxins present in the environment can cause a mother to give birth to a baby with gastroschisis. Now, I'll move on to the diagnosis. How do people know that they are with a baby with gastroschisis, or how do you know that a baby has gastroschisis? Now, first, if you are a mother who does echography from time to time, it can be identified during your echography. It can be seen because they'll see the baby's intestines floating in the image of the echography. Sadly enough, our echography, as I always say in Africa, I don't know if it's the hospital which did my own echography when I was pregnant, or that is how it is everywhere in Cameroon. But I don't think the echography I did when I was pregnant can actually show gastroschisis. I don't think so. Because I wasn't seeing the shape of my babies. All I was seeing were dots. So there you go. Another way which you can be diagnosed is after birth. Immediately after birth, the doctors are going to see that the baby has gastroschisis because the intestines are going to be outside. Now, it is very important for us to know that mothers with babies who have gastroschisis can still push their babies out and give birth vaginally. So your baby having the birth defect of gastroschisis doesn't warrant a C-section. No. With a baby with gastroschisis, you can still push the baby, but maybe for cases of some other things, your doctor or some other health issues, your doctor might suggest that you go through a CS. But most times, if you give birth to a baby with gastroschisis, there's already a lot of trauma. Like just having in mind that you're pregnant with a baby who has some kind of birth defect is already very traumatizing. And they are trying not to put the mother in any more trauma, because you going through a CS, you're going to be bedridden for some time. You're going to be in a way that you can't really do much for some time. And gastroschisis is really a birth defect which, like the others, tends to be very traumatizing, because you give birth to your baby, you can't hold your baby is crying, you can't hold your baby and let your baby feel your body like how a normal mother will do. So you give birth to your baby, and the next thing they are doing, they are taking your baby maybe to the theater, they are taking your baby to intensive care. It's really traumatizing. But being aware of the fact that maybe your baby will be born with a defect earlier on before the baby is born at least prepares your mind and helps you to manage a situation when it actually comes, when the baby actually comes. So it is very important that you do your echographies to know how your baby is doing and to know the things that you just prepare your mind for anything which is supposed to come. Because there is a lot that goes on while you're pregnant that you have to at least know how your baby is. Okay, now, how is gastroschisis treated? When you're discovered to have a baby with gastroschisis, there is nothing that can be done for your baby while your baby is inside your tummy. As far as your baby has that defect and it has been detected, or it hasn't, there's nothing that can be done while your baby is in your tummy. The only thing that can be done is when your baby is out of your tummy. And this is usually rectified with a surgery. That is, before the surgery is done in stages, because most times babies who are born with gastroschisis are usually smaller than normal babies. And also, most babies who are born with gastroschisis, they are usually born preterm. They are born before their actual date of being born, because there might be some complications during the 36 to 38 weeks of pregnancy. So most times it is very important that they deliver the baby before time so that they can start trying to solve the baby's problem. And due to the fact that the babies with gastroschisis are usually born smaller than normal babies, because their organs or their intestines didn't form inside, their tummies are usually smaller and tighter. So when the baby is born, immediately after birth, they're usually taken to the theater to look for a way to start pushing the intestines back slowly. They don't push it all at once. In cases where the intestines which are out are not much, it can be pushed in at once. But most times it is done in stages. In cases where a lot of the intestines are outside, it's done in about 4 to 5 stages, which can take a period of 5 to 7 days. Because the baby's tummy is not big, they don't want to force it all in at once. You imagine forcing, maybe like putting water into a balloon, and it makes the balloon to expand too much. So they don't want to stress the baby's abdomen. So they try as much as possible to put the intestines back gently. In case where there are other organs which are outside, they might have to maybe increase the hole to be able to push those organs back inside. But it is not a very complicated procedure. And if a surgery is not done to push the intestines back inside, there's usually this plastic, like a plastic bag made with some kind of silicone material, which is put on the baby. So they kind of hold the baby's intestines up and they put it up in that plastic and it's tied and held up somehow, like how a drip is, but it doesn't have the small extension. That's a crazy example. Like how an infusion is, right? But it doesn't have the small extension. So they put it around the baby's navel, and they secure it very well to the tummy, and then they put it up so that the law of gravity, you know that anything that goes up will come down, right? So the law of gravity can help push the intestines back into the baby gradually and in a very organized manner. So most times that is what is done, because the fact that the intestines are outside, they are exposed to air, they are exposed to everything which is outside. And being something fleshy, if it is not covered like that, it can lose moisture, it can get bacterial infections and everything. So babies born with gastroschisis are put on antibiotics constantly so as to help reduce the chances of infections, because we don't want the baby having infections, because that's going to be another whole other problem. So this plastic or silicone kind of bag is put on the baby's tummy with the intestines inside and then placed in a way that the intestines can go in naturally. And after some few days, the intestines must have gone in by themselves. And then the baby will be taken to surgery, given general anesthesia. And then that hole, which is beside the navel, which is the umbilical cord, will be closed. So the navel looks normal. But most times, children born with gastroschisis usually have problems of digestion, eating issues, or sucking issues, because they don't digest like normal people will, because of the fact that their intestines were formed outside, and normally the intestines have been mixed with the amniotic fluid and everything, and sometimes with the swelling and all those things, it makes the intestine not to function well. So babies with gastroschisis stand a greater chance of having digestion problems, problems with constipation, problems with eating, problems with their bodies even extracting the right nutrients from the food that they are eating. So that is typically gastroschisis for you. And I think I've elapsed everything which is there to say about gastroschisis. Okay, there's this one thing which I jotted, excuse me, to talk about. According to science, let me try to make this a little bit more understandable. While the baby is forming, as I said, what makes the baby's body to form very well is blood tissues, right? The circulation of blood has to be very okay for all those tissues to form very well and form normally. Now, when there is not enough blood tissues flowing into the abdominal layer when it is forming, there can be that hole, which is where the baby's intestines would pass through and then form outside. This particular thing is called, according to science, vascular disruption theory, because they say that if the blood flow does not flow very well to the abdominal walls while it is forming, it will leave that gap where the intestines will form outside. So that's typically it. And I think I've said everything about gastroschisis. That is all there is to know about it. It's not as complicated as you think. If a baby is born with it, it can be easily rectified, except in cases of other complications. And babies born with gastroschisis usually do not have any other birth defects, except in rare cases where you see babies with gastroschisis having other birth defects, apart from the fact that they will have digestion issues just because their intestines were outside. So that's typically it about gastroschisis. And yeah, I tried to explain gastroschisis and then explain the other abdominal birth defect, which people mostly confuse for gastroschisis. But that is it. If you have some questions, please, I would like you to state them so we can answer your questions, and we can leave here. Mothers are usually very busy. One thing which they always say is, I don't have time. I don't have time. We all don't have time, right? We all don't have time, but we have to create time. I always say that we create time for what is important. So if you have questions about everything that I've said, anything that I've said, please leave your questions so we can answer them, and then move on to the winners of our quiz for this week, and then we can leave this place. Okay, I can see trusted coins. Wow, that's my brother right there. Thank you so much for joining. I can see Lady Giselle Itala. Thank you so much for joining. Do you have any questions about gastroschisis? Please drop a question. Let's answer them so that you can clear your mind. If you see the situation somewhere, you see pictures of it, you can explain it to someone, all right? That's the aim of it. It's not about just telling you and you knowing about it. It's for you to be able to explain it to someone else so that they too are informed. Please, if you're here, try to share the video so that other mothers can see this. Okay, while I'm waiting for your questions, I'll go ahead to announce the winners of our quiz for this week. Please, I'm going to need my phone for that. I'm going to be announcing the winners for our quiz for this week. It's really sad for me. It's not a very happy day for me from our quiz yesterday. I felt really bad. It's saddening how mothers are, I don't know, how mothers cannot create time to educate themselves. I realized the weeks which we had gifts on our Inyango Moms quiz, more mothers participated. And these weeks which we don't have so much, we don't have gifts or things to win, I realized the number of mothers who are participating is reducing, which is sad, which is so sad. It's sad. I have actually been working with mothers for a year and some months now, with the mothers on the Nyango WhatsApp group closely. So I can say that I understand mothers somehow. That is why in the first place, we decided to do the Nyango Moms quiz and attach prizes on it so that mothers can be motivated. Because mothers that we are, we don't do anything for nothing. We don't have time. So I understood that if there are no gifts or incentives, mothers will not participate. And it's so sad to actually see that it is true. I don't want to believe that it is true, but I am forced to. Please, mothers, right? Let's try as much as we can to educate ourselves. I'll always say this. Let's try as much as we can to educate ourselves. It's very, very important, not just for you, excuse me, but for your children. Your children need that education. They do need it. Most times we feel very comfortable and we don't worry because we've not seen certain things. I'll always go back to my experience with my daughter in the hospital for 3 months. The things I saw made me to be more determined. Even if I come here today and I'm doing a live and there is no mother watching me, I will continue doing it and I'll continue talking. Even if I come here today and there is no like on social media, I'll continue doing what I'm doing. Because in as much as I want mothers to learn these things before they face them, a lot of mothers might reach my page or our page and start learning these things when it is late. And I don't want that. That's why I'm putting the information here. So that someday some mother might stumble on this and they might learn one thing or the other. Because it is very important that we get educated about certain things. With children, you can never know what will go wrong the next minute. Get yourself educated as much as you can. If we're having a quiz that helps mothers get educated and you can sponsor us, please, we do need sponsors. We've been running the quiz for 7 weeks now. Yeah, we just had the 7th edition. And the first 5 editions, we had sponsors. And it went so well. Mothers are participating. And then the 6th and 7th week now, we have not had sponsors. And we realize that mothers are not participating as much. Please help us educate mothers. Sponsor the quiz, gift mothers something so that our quiz can go on and we can continue educating mothers. It is very important for mothers to get educated. Imagine that mothers don't know the situations which can come up with their kids. How then do they raise wonderful kids? What does the future generation hold for us if the mothers are so uninformed? Please help Inyango educate mothers. That's our first project, to educate as many mothers as we can. to make mothers know the reason why they have to be educated. So right now, I'm going to announce the winners of our quiz. Unfortunately, just 3 people participated, but from their answers, we could tell who watched the video and who did not. Most times we would advise mothers to watch a certain video because we might not have all the information there, but we do have something which will push you to want to learn more about the topic. That is why we send you to watch a particular video. And motherhood is such a broad and vague topic that we can't just post questions like that without giving leads that you can go and learn to help you know these things. So our winners for the quiz, unfortunately, we have just 2 winners for this week since a lot of mothers didn't participate. I don't know if it is because we are not giving gifts anymore or we don't have sponsors anymore who have to give them gifts. But whatever the case, we have just a first and a second prize winner. And being a mother that I am, mothers are supposed to be givers. It starts from us giving, right? So for last week, we had a special gift from our sponsor of the previous week, which we gave to the first prize winner. And the other 2 winners in Yango opted to gift them data bundles since they spend their data bundles to participate on the quiz. That is what we could give them. And this week again, since we have 2 prize winners, the first and the second, we are going to be gifting data bundles again to the first and second prize winner. I want to really appreciate Lady FHC Doe for participating on the quiz. But please, my lady, try to watch the video which was stipulated for us to watch. That is what gives you a right answer. Your answer is not wrong, but the instructions are watch the video and then give your answer. So our 2 prize winners, the first prize winner is Lady Christine Mengot. She has been so consistent, and I like how consistent she is. Whether there are prizes or not, she's there the first person. I really give a shout out to her, and I appreciate her so much for being here and participating on the quiz. The next prize winner is Lady Giselle Itala. This is another very consistent lady. Thank you so much for being here. And thank you for participating on the quiz, despite the fact that there were no announced sponsors or no prizes to be won. I really appreciate mothers who take out the time to educate themselves, because if you love your children, if you love your life, you love your family, it is one thing you should do. Okay, that was it for today. Since there are no questions and we've come to the end of the topic for the day, I would like to say goodbye. Thank you all so much for joining, and thank you all so much for being here. Hope you learned something, and hope this could help a mother out there, and hope this could yield or help a mother have a healthy baby out there. Thank you all so much for joining, and let's build healthy moms to healthy homes while we strive to raise healthy, wealthy, and exemplary mothers. For me, it's going to be goodbye. Thank you all so much for joining, and do have a beautiful evening. Bye-bye.